small brief then he will question you what facilities you provide. Then that would be one frame.
Okay.
Remove this. No. It would be great. Yes. Now.
Yes. Okay, Doctor. My name is Dr. Alex from Tanzania. I'm representing my company. We want to do an extension of treatment from Tanzania to India,
Yes.
particularly in our clinic and the service that we're providing. So on behalf of my company, I would like to know about this hospital, starting from myself. Yes. What do you measure? And in your facility or in your hospital, what procedure are you doing? Yeah. What can I promise my people that one day reach in India, in Ahmedabad, specifically in this hospital?
Yeah.
What are the promise that
Okay.
you should have?
Okay. So again, myself, Dr. Ruchi Mehta. I am MS ophthalmologist. I've also completed DNB ophthalmology and I have a fellowship in vitreoretinal surgery. I have established this hospital since 2017, April 2017. It's been almost 8 to 9 years in the working in this particular area. We provide all kind of retinal, glaucoma, cornea, and I would say more enlarged, it is ophthalmic surgeries. We have retinal lasers. We have facilities to provide diagnostic modalities in retina and glaucoma diseases. Then we have a modular operation theatre which can conduct complex retinal, cataract and glaucoma surgeries again. I have also completed certain clinical research which I talked about, FDA, non-FDA and DCGA trials over here. I've been part of clinical research trials since 2019. It's been a 5 years journey with clinical research setup. And we have certain, I would say, we have peripheral centers as well to help the patients from multiple classes, other classes as well. So I go as a visiting consultant in remote places of Ahmedabad like Ratinpur, Bodasa, Idar and Ahmedabad. So these are 4 centers we also cater along with this particular center.
Okay, thank you. But also another question about if people are doctors or medical personnel from Tanzania, from Africa wants to come for fellowship.
Yeah, we can provide that, yes. See, for fellowship, I told you that we can have a planning of a medical and a surgical retinal fellowship. One will be a short-term fellowship, another will be a long-term fellowship.
Like a short time for long time?
Short-time fellowship can be offered for 3 months to 6 months. We can have a 3-month course. Someone who wants to learn it fast, invest more time into it, so can come for a short-term fellowship. And then a long-term fellowship of surgical retina will be of 1 year, because minimum 1 year time is needed to understand the disease, to understand the treatment modalities, to have a hands-on on multiple things, because a macular surgery is done in a certain way and a retinal detachment surgery is done in a certain way. To master or to have a proper hands-on, one has to have at least 100 to 150 vitrectomies in his portfolio. So for a long-term retina fellowship, 1 year time I would feel that is needed minimum. And for a short-term fellowship, yes, 3 months or 6 months, depending upon a person's requirement. And we can do that. Yeah.
Thank you.
Thank you so much.
Thank you.